Jennifer.
Yes.
Hi, I'm Laura.
Nice
I'll be
to
doing
meet
your
you.
ultrasound. We're gonna go right down the hall to the right.
Having a baby brings on so many changes for a woman's body. An ultrasound can help new moms understand what's going on the inside.
You can just lay on your back, face up. I'm going to give you this for under your legs. It feels kind of good. The benefits of ultrasound is it's a non-invasive procedure. It's simple. It does not require any needles. It's just imaging, but it gives information to the provider and in regards to how the mother's body looks and how the fetus looks, but it's also helping the doctors to manage their care. Here's your baby. It's overwhelming to come into a doctor's office, and a lot of the players, people do not know who we are. Dr. Winkler, you remember Dr. Winkler from your last pregnancy?
Good seeing you again.
Typically the patient will check into the front. I'm the sonographer. I'm the one that will provide the images for the doctor's review. The nuchal looked like it was about 1.1, which is nice. I will explain to the patient what we're going to do. We typically look at their uterus, we look at the size and the shape, we locate the placenta, we make sure there's not a previa, and we look at the length of her cervix. We go lengthwise and then crosswise to make sure she's not at risk for preterm labor. And then we look at the fetus, and depending upon the age of the fetus, it could be a simple head to bottom, which is called a crown rump length measurement, or we could actually measure several structures. Then the doctor comes in and is able to explain what we see on the ultrasound.
Knowing that your baby is healthy is every parent's #1 concern, but an ultrasound does more than that. When a new parent sees an image of their baby for the first time,
This is the
the
forehead.
amazing miracle of having a baby becomes real.
The question always comes up, why did you have the ultrasound? A lot of patients still assume that ultrasound is just for looking at gender. Of course, that is one of the benefits. We can tell pretty darn early what the gender of the baby is. But for us, most of us would like to offer the physician who's ordering the exam information regarding how the baby looks, and that entails the heart, the brain, the kidneys, the spine, all the different structures. So it's not just for the gender anymore. It looks like it might be a little girl. So it might be a little girl.
Doctors want no surprises, and therefore order an ultrasound in the first trimester.
I think a lot of the physicians who are reading the current literature are seeing that we're doing ultrasounds typically between 11 and 14 weeks, the first trimester going into the second trimester. The information there allows us to see how big the baby is. We can get correct dates. We can see how many fetuses there are. And we look at the nuchal translucency, and especially looking at the back of the neck, the nuchal translucency, which is an indicator for chromosomal or heart defects.
Doctors used to order ultrasounds at 16 to 18 weeks. However, new studies have shown the only time you can see the increased nuchal translucency
Right in here.
is in an ultrasound when the fetus is between 11 and 14 weeks. It resolves after that time and is no longer visible. New equipment with high resolution helps view nuchal translucency and allows the specialist to get more detailed information. The new equipment has also resulted in a declining number of amniocentesis tests ordered.
The question comes up, do you still have to have an amniocentesis? That still is the gold standard. That will give you pretty much 99% assurance that there is not a Down syndrome possibility. However, these days, with the high resolution ultrasound, being able to see such high detail of the structures, we can tell what appears normal and what does not appear normal. Unfortunately, 60% of the babies can look normal and have an abnormality. So we've also been able to, within the last few years, combine a normal ultrasound image or normal case with the results with lab values. And if they come back in the favor of the patient, they're at a point where they can actually reduce the risk and tell the patient with about 90% accuracy that your baby does not have Down syndrome. Congratulations.
Most new moms will have at least one ultrasound. If you're at risk for having a large baby, though, you may return for another ultrasound between 28 and 32 weeks to measure the size of the baby.
I have some baby pictures for you. There you go. This is the profile views, and then the whole
While
baby.
all this information is wonderful, one of the best things about an ultrasound is getting the very first picture of your baby.
Ultrasound is the way that you are going to actually see your baby before it's born. And the mother can actually feel the baby and feel different movements and feel the changes in her body. Her partner can only vicariously enjoy that. This is a way for the partner and the family and the couple to see the baby moving and to actually see the facial expressions and the yawns, and it's a wonderful opportunity for a preview to see their baby.
Seeing your baby for the first time. An awesome experience.
Okay, well, it's nice meeting you. Congratulations,
Thank
and we'll
you.
probably see you in a couple of months.
And a lot to think about on the way home.